gastropathy developing the patient. Gastropathy, pathy is a disease. Gastro is the stomach, of course. So signs of gastropathy developing the patient with rheumatoid arthritis who was treated with indomethacin. With what activity of the drug can this complication be connected? Indomethacin is a non-steroid. Okay, first of all, rheumatoid arthritis, or when it is, what comes to your mind is inflammation. Inflammation. On the joints. So when you hear arthritis, that is what it is. It comes with so many other features like warm sensation there and warm sensation there, and the redness and all of that. But the main thing is the inflammation there. So that's arthritis. Remember, any itis, there's a suffix. Itis in medicine is swelling or inflammation. Gastritis, pancreatitis. I said pathy is disease. Let me write this in brackets so you remember. DX, small d, not big, capital letter D. So what's treated with indomethacin? Indomethacin is what? A non-steroidal anti-inflammatory drug. That is what indomethacin is. With what activity of the drug can this complication be connected with? Now, NSAIDs are the way they act, they're like competitive inhibitors of COX-2. Now, COX-2, how do I put it in a part? Okay. Competitive. No, let me use this straightforward grammar here. Inhibit COX-2. And what does COX-2 do? COX-2 actually converts endoperoxides in the cell. Endoperoxide rather. Converts them to arachnoid acid. Arachnoid acid. And then this arachnoid acid will form the basis of prostaglandins. And the prostaglandins also forms the basis of inflammation. So that's what COX-2 does. That's the enzyme, cyclooxygenase. Yeah, cyclooxygenase. So it will help with this conversion, and then there will be inflammation rather later. Now this NSAID go to inhibit COX-2. So as it's inhibiting, there will be no, from here, in short, from here, there will be no conversion from endoperoxide to arachnoid acid. So they're asking us what the activity of this drug does. So we can see here in the option we have anti-cyclooxygenase. Yes, that's the activity, anti-cyclooxygenase, just like I've explained here. Or in case you don't see this, and then you see, and that's why I wrote COX-2 here, so you take notes. In case you see option F, COX-1, option G, COX-2. This is the most correct answer. 1, 2, 3, then followed by this, and then followed by this, in that order. Hope we're together. So this is just a general term, anti-cyclooxygenase. cyclooxygenase. This COX I wrote here is also anti, please. It's not just COX-1, COX-2, it's also anti. Since we're talking about the activity of the drug itself. Anti, so F option and then G option here. So these are the three answers you can give concerning this. But first of all, COX-2 is the most preferred answer. COX-1 is the second, and then anti-cyclooxygenase. That's a general name for both of them. Question 17. Testosterone and its analog increase the mass of skeletal muscle that allows to use them for treatment of dystrophy. Due to interaction of the hormone with what cell substance is this action caused? So they're asking us, um, these are all cell substances and particles. So remember that ribosomes are for RNA and DNA structure. Chromatin are DNA, just DNA proteins. And brain receptors are just there outside. Then the nucleus or nuclei have the chromatids and also chromosomes. So dystrophy is a chromosomal abnormality. Dystrophy will have different types. Okay, whatever our skeletal muscle. So yeah, I will specific. It will be deficient. It will be muscular dystrophy. Sorry. Muscular dystrophy. And then we'll have what? Duchenne or Duchenne, I can't remember. And then we'll have Becker. Becker's dystrophy, muscular dystrophy. So these are all chromosomal abnormalities. Unlike the other inheritance, we used to have sex link and all of that. This more of the chromosomes. So abnormalities. All right. So that's what I talk about the nucleus of the cell. This is the answer, or you can see cell nucleus. Cell nucleus. So how you see the option here? Patient is ill with neurodermatitis, has been taking prednisolone for a long time. Examination revealed high rates of sugar in his blood. The complication is caused by drug influence upon the following link of carbohydrates metabolism. Now, prednisolone reduces inflammation, just like anti-inflammatory drugs too. So prednisolone here reduces inflammation. I told you anything itis is inflammation. So neurodermatitis is skin swelling with a background cause from the higher center, that's from